All right, everyone. Nurse Stephanie Victoria here. I am going to lecture the entire MAP medication administration program um, in Massachusetts, the entire curriculum. Okay. It's called Responsibilities in Action. And I'm going to sit here just chit chat with you. So I'm going to pull it up and just talk to you to help you pass this. Okay. So this is going to be part one. If you could check the link out if you want to take practice questions. But if you're in the state of Mass, you can visit my school, Healthcare-Edu, and our number is 508-5. But let's get right to it. I'm always shocked how people don't know exactly what the MAP certificate is. It's called Medication Administration Program in the state of Massachusetts. And in some states, it's called like Meditech. Now, what it is, it allows you to give medications in a group home setting. So I have a lot of videos that go over exactly where you're able to work with it and where you're not. And that's very, very, very important. And we'll get to that. But for example, in Massachusetts, it's 2 days and it's 20 hours online. And that amount of time, you can't become a nurse, a pharmacist, or anything like that. So you're basically the middle person. These group homes, they are DDS, Department of Developmental Disabilities, DCF, Children in Foster Care, and also DMH, Department of Mental Health. So these are individuals, because of their diagnosis going way back, like say 1920s, they might have been institutionalized, right? And so there's a push to deinstitutionalize, meaning to make them live more in a community setting, right? But if somebody has really bad schizophrenia, for example, under the DMH, they might be able to live in a group home, but they can't give themselves meds and things like that. So you serve as that in between. So honestly, it's the biggest bang for your buck. I know here at my school, I do 600 and a lot of jobs you'll work, get employed and they'll give it to you as a training. You know what I mean? So I have people get the certificate because they want to put themselves above the pack to get the job. But a lot of jobs offer the training for free, or you could go to places that will train you on it. All right. So let us talk about I talked to you about the type of homes, and let's do a day in the life before we really get into it. The certified MAP staff brings clients to the doctor's appointments. They receive doctor's orders over the phone. They transcribe, which means to copy. And so if you like this playlist, I have a whole transcription video. They transcribe. What they also do is that they administer medication. So it's a huge, huge role. Now, before we get into all the other components of the role, this is for you to become a MAP certified staff, right? So that's the key term, that role that I just described. But also, there is something called a MAP consultant. So think about it like this. If you could take a certificate program, do 2 days and 20 hours online, that means that there's a lot of wealth of information you don't know medically, right? So if you think about it, it makes sense. So if you're in a home with someone and they say, I'm feeling nauseous, you're not a doctor to diagnose and just come up with what and say, oh, I'm going to order you this. No, you need someone to call for more medical judgment, and inserts the MAP consultant. Okay. So you're a certified MAP staff. There's a MAP consultant that's available 24 hours a day. And there's doctors. So all these people are your healthcare team. But I would say the MAP certified staff, the MAP consultant who you call for clinical judgment or say something's going on. And then you have a MAP certified supervisor. So the person who's overseeing the group home, that might be somebody you call if a medication's missing or if there's no more money, the client wants to go here. So that's somebody running the group home. That's not necessarily the nurse on call to say, hey, the patient threw up 3 times. What do I do? Do you understand? So there's you, the MAP certified staff. There is the MAP consultant, is someone you call for medical expertise. And then there's the MAP certified supervisor. That person makes sure the group home is running smoothly. So I hope that makes sense. Those 3 roles are very important to understand. Okay. Now let's get into the MAP staff, okay? So the MAP staff, first thing you want to know is who can you call? Who is qualified to be a MAP consultant, okay? So in order to be a MAP consultant, you have to have a degree or credentials that you are able to provide that advice. So a registered nurse can be a MAP consultant. Now, the devil's in the detail. This is way different from an LPN. This is a registered nurse. An LPN cannot be a MAP consultant, but an RN can. Okay, you have a registered pharmacist. And again, it's not a pharmacy tech. Like when you run through CVS and the pharmacy tech at the window, they're not the registered pharmacist most likely. So it's not a pharmacy tech cannot be a MAP consultant, but a registered pharmacist can. And a healthcare provider, HCP. That's going to be very important to remember. Throughout HCP, they are people who can prescribe. So you have to look into your state, but state specific, Massachusetts, it's an MD, a medical doctor can prescribe. A NP, which is a nurse practitioner, or sometimes they'll say APRN, advanced practice registered nurse. Who else can prescribe? A dentist, okay, a physical therapist, a PA, physician assistant. So those are people. So when people sign a medication you're about to give, you got to look at the credentials and sign and make sure that they are able to order meds or else it's null and void, okay? So again, the people who can be MAP consultants are MDs, medical doctors, NPs, nurse practitioners, PAs, physician assistants, APRNs, which is also nurse practitioners called advanced practice registered nurse, dentist, I think they're DMDs, nurse midwife, all right, certified nurse midwife. So that's pretty much the bulk of it. And you could always check this with your state. And I suggest that you do that. So you will have test questions. So I'm lecturing for you to understand and pass the exam. So they will give you test questions on who's able to be a MAP consultant. Okay, so we'll go over that. Now, you would call the MAP consultant, like I said, is for medical expertise. It's not things to make the group home run effectively. So if too much or too little of the medication was given, that's a medication error. We'll go over that. If a medication wasn't given at all, if the doctor's order and the pharmacy label don't agree, like I said, if they were nauseous, a group home always has a MAP consultant available 24 hours, 7 days a week, okay, on the phone. So you have 911 if there's an emergency, and you have MAP consultant, all right? So there's always going to be something posted on who you're to call, okay? So 911, if there's a fire, you're not calling the MAP consultant, you're calling 911 following fire protocols. If someone hits their head and things like that. So there's things, if someone says chest pain, you call 911 first. And we'll go over that thoroughly. But there's always something posted for you to understand. It's the 911 number, the poison control number, the MAP consultant number, the pharmacy number. There's always a list of numbers, whoever your program supervisor is, and the healthcare provider. So that's always like on one sheet of paper that you can look up. All right. So let's continue on. I'm going to say true or false. So this is Nurse Stephanie Victoria here. I'm doing the entire lecture on MAP. I'll do it over this week. It's probably going to take me like 4 or 5 parts to do. And so I'm going over the responsibilities and actions curriculum, and I'm in the state of Massachusetts. So if there's subtle differences, you want to look at your state, okay? So again, I'm in the state of Massachusetts. So let us review who can be a MAP consultant. And so LPN, they cannot be a MAP consultant. A pharmacy technician cannot be a MAP consultant. A registered nurse can be a MAP consultant. The receptionist at the HCP office cannot be. The healthcare provider can be. Yes, they can be a MAP consultant. This one is a tricky one. The MAP certified supervisor or program director cannot. They are not MAP consultants, and the registered pharmacists are MAP consultants. So if you'd like to follow along with me, I am just lecturing and chatting using the responsibilities and action curriculum with the state of Massachusetts and reviewing the MAP program. Okay. So let's talk about what you're doing. Let's expand on the role a little bit. Okay. So you are observing and watching the person, you're talking to the person, you're listening, you're communicating, and you're participating. All right. So we covered kind of your job description. We'll get more into that. We cover who you could call, more so the MAP consultant. Now let's go. The whole program is called MAP, Medication Administration Program. So let's get into the actual administration of medication. Okay, so let's get into that. Now, you want to make sure you're able to give meds safely. Okay, so there's three things. Of course, they put it in like more formal terminology, but the three things: mindfulness. Listen, guys, don't make things complicated. You want to just pass your exam. Mindfulness is that you're paying attention. You're not watching YouTube in the background. You're not trying to give meds in the middle of a party. All the patients are around. Mindfulness is that everything's quiet, clear. You've taken to the client to a separate area, and now you can focus on what you're doing, okay? It's not a game. People can really get hurt, so you have to be mindful, all right? And these are vulnerable population. People can't defend themselves, so you want to make sure. Also, the next concept, so that's the concept of mindfulness. It's a test question. These are the principles, the underlying foundation to administer a medication. We haven't gone into the med administration part yet, but the foundation. So there's three foundations. The first one I just told you is mindfulness. The second one is supporting abilities, okay? So whatever they're able to do on their own, if they could hold a glass of water, you're not going to hold it for them. You're going to let them do it. So you have to meet the patient where they're at, essentially. If they can go to the doctor and explain to the doctor what's hurting, don't jump in and say, no, you can't explain it. Let them say, and if there's anything you need to add, just because they have some limitations, you might be able to do that, but you have to support the person's own abilities. And the last step, so there's three: mindfulness, supporting abilities, and communication. You have verbal communication and you have written communication, or orders coming through the phone. Either way, your entire job is to communicate in person, verbally, via the computer, by what you read. You are performing some sort of communication. You call 911, you're communicating. You call the MAP consultant, you're communicating. You have to do all of this so that you could do your job effectively, okay? And so we talk about documenting and everything like that. So you have to speak clear, slowly. And I like to say, even though the MAP state they translate it so you could go through school, you have to speak. The whole job, when these doctor's orders are coming through and all of that, English is fundamental. So I will just like and subscribe, guys, this page, because I have a healthcare ESL coming out, and I really think you all need it. Again, not just regular English as a second language, but healthcare, so that you can get these allied health jobs, okay? But I digress. Let me continue. You have to listen carefully and all of that. So these are fundamental principles of communication. Speak clearly and slowly, look at the person in their eyes, listen carefully, ask questions, repeat back, check for understanding, and all of that, okay? So this is part one. I was saying 4 parts. I don't know what I was thinking. It's like 292 pages. So I'll go over all of it. I'm trying to do this next week. So just follow the parts so you can learn it in sequence. And I want you to pass your state exam. So this is part one. I'm going to stop here. Again, if you want to order the responsibilities in action, or if you have it, or if you're in the state of Mass, but if not, just look and see and check the link below. I have multiple choice questions and things like that to help you become MAP certified. Like and subscribe and like this playlist, and I will come back for part 2. So don't forget to be essential. All right. Bye.